Welcome back to your Feel Good Breakfast Show. This is Expresso, and it's Health Tuesday on Expresso, as you know, and it's time to get up to date on the numbers. A fifth case of monkeypox has been detected in the country. Health Minister Joe Phaahla is encouraging people with symptoms to report to their nearest healthcare facility. Now, with us this morning to chat more about monkeypox is HIV and infectious diseases expert Dr. Emil Reid and pathologist Dr. Howard Newman. If you have any questions, and I need you to ask questions as well, today it's not a means to get very, very scared of this. I think information is valuable when it comes to any sort of ailment or any sort of outbreak of anything. So make sure you get those questions in 063-408-8863. Gentlemen, you look so fresh and early and just it looks fantastic, both of you. Hey, looking good out there.
Well, Carlos, it's cold, brother.
Yeah.
It's cold.
That's what I like. Carlos, yes. But can I confirm that when we have these discussions, we are not trying to incite any sort of, we're not trying to scare anybody.
No.
We're trying to just inform, because I think that an informed individual is somebody who knows exactly what to do in any sort of circumstance. So I think let's start with you. By the way, Dr. Howard, welcome. We've been waiting for you for this moment for a long time. It's fantastic.
Thank you. Thanks for having me.
So, monkeypox. I mean, the name sounds quite ominous, but can we break it down? What is monkeypox?
Okay, so monkeypox is a type of virus. It belongs to the Poxviridae family of viruses.
Okay.
It shares a genus with, some of us might remember, smallpox.
Yes.
It was eradicated in 1977, so it's in the same sort of family. So monkeypox tends to circulate amongst certain animals, rodents in particular, in Central and West Africa. And then from time to time, you can have human infection as well.
Yeah.
And then like we're seeing now, you can have human-to-human transmission. So these viruses, they tend to cause typical skin lesions. We call them like pox lesions, and hence the name.
Okay.
And this particular pox virus was first discovered in monkeys in the 1950s, and hence the name monkeypox. So yeah,
All right.
that's essentially what it is.
That was a lovely breakdown, because that's what we need, we need the layman's terms. Not everybody knows the medical jargon, and I think that's the way we, consume this information. But in terms of spreading, I think that's the whole thing about it. When you are out there and you're worried, I think it's important. So, Dr. Emil, you've been with us through the entire COVID outbreak, making sure that we feel okay. But this particular time around, how does this spread?
Well, the big thing, as Dr. Newman said, he used the term rodents, and then also from people to people.
Yeah.
But monkeypox is actually what we call a zoonosis, meaning that they start off in animals.
Okay.
And they don't start off in humans. And usually the transmission is from a rodent or an animal to a human, and it can happen vice versa as well, but it's very, very rare. And I think both of us will agree that in order for somebody to contract monkeypox is really, really, really difficult. So it's unlike COVID, where I pass you and and there you have your SARS-CoV-2 virus in your system. And in order for you to transfer this virus, you actually need prolonged contact. So say for instance, isolation, we share a cabin together, we share a bed together, we touch one another, we stay in touch for a few days, and that's actually how transmission occurs. But walking past somebody, touching somebody, reaching out to somebody, giving them a hug, the chances of actually acquiring monkeypox is extremely small.
Just to jump over to another question, because, this is the one that we always asked you, especially throughout the past 2 years, but are we going to go through a vaccine rollout again? Do you see this as the health minister makes, some announcements around a fifth case? Are we going to go there again? What does your gut tell you?
Well, my gut tells me there are certain reasons why people make certain decisions.
Yes.
So if somebody comes out and they actually tell you, monkeypox is now a thing, and one need to be scared or take note of it.
Yes.
It doesn't mean it's a serious illness. It doesn't mean people are going to die, because if you look at the central types of monkeypox that we find, we look at about a 10% mortality. If you look at the Western African form of monkeypox, it's around about a 1% mortality. Okay. So the cases are still quite low. So the reason for people to say, well, we need to put monkeypox on the map, there's certain reasons for that to occur, meaning that we need to develop therapeutics and we need to gain access to so-called vaccines that are available. Yeah. And the sooner we actually put it on the map, the sooner we can actually have access to therapeutics and the sooner we can have access to vaccinations. So I don't believe, and I mean, Dr. Newman can disagree with me, but I don't agree that we're going to go through anything, not anything remotely similar to what we've been through the last 2 years.
Well, agree or disagree, that's why we have a part 2 with Dr. Emile Reid and Dr. Howard Newman. Also, we need to discuss some of the symptoms of monkeypox. We're going to keep you in the know on your Feel Good Breakfast Show as we also keep you as healthy as we can and build the immune system through some good old exercise. Graham is standing by.
It's my Feel Good Breakfast Show.
Welcome back. This is your Feel Good Breakfast Show, Expresso. Now, despite 2 new cases of monkeypox being reported, the health department says the risk of infection is still low for South Africans, which is why we're having this discussion. With us this morning to chat more about monkeypox is HIV and infectious diseases expert Dr. Emile Reid and pathologist Dr. Howard Newman. If you've got any questions, the number, once again, 063-408-8863. Let's continue the discussion, gentlemen, and I think it's important for us to go to a point around how severe the monkeypox, the virus can be. I think let's look at that scenario for a second. Once again, not to scare, but of course to inform.
Firstly, it's important to note that the vast majority of cases are mild.
Yes.
So people will recover without any treatment, and that's the vast majority of cases. And with this current outbreak, it's slightly different to previous outbreaks where the skin lesions are predominantly in the genital area.
Okay.
And it's because of the way this outbreak started with sexual activity, essentially. You can have severe disease. So some people, unfortunately, are prone to having more severe disease. So you can have complications as well. There have been reports of people having encephalitis, that's swelling on the brain, eye infection, even pneumonia. So there are severe cases and complications that can happen, but the vast majority is mild and recovers without any treatment.
You mentioned a few symptoms over there. You mentioned lesioning on the genital area. What other symptoms are there on monkeypox?
Okay, so when you get infected for the first time, most people will have what we call a prodrome. So that's when they have flu-like symptoms, essentially. Okay, so fever, headache, muscle aches, etc. That's after an incubation period of about 5 to 13 days on average, but it can be a bit longer. After that, about 3 days after those initial symptoms, you start getting skin lesions. These skin lesions, they go through various stages. They start as flat macules, we call them, and they progress through vesicles and pustules eventually. And the skin lesions, typically, it's on the face, the hands, and the feet, but with this outbreak, it's more in the genital area. So this is slightly different to previous outbreaks. But yeah, those are the symptoms. The main thing would be the skin lesions that people would worry about. Yeah.
Brilliant. Now, the thing is, we're also here to answer some of your questions. That's why we have the experts on the couch. Jocelyn has this voice note that has come through. Let's take a listen to her.
Good morning, my Expresso family and the medical team. I just want to thank you so much for the vital information in connection with the monkeypox. Thank you so much. Have a blessed day. Thank you, Jocelyn. Our gardens. Bye.
That was Jocelyn, just in case you didn't hear that. That was Jocelyn just saying thank you so much for giving us a bit more details on this as well. Simon Gila, you're next.
Good morning, good morning. Can I please ask if monkeypox is contagious?
Okay, no problem. We'll actually get to that question in the next couple of moments. So please don't worry about that. We've got you covered. But before we get onto there, let's look at a global level. Dr. Emile Reid, the WHO has said this is a health emergency. Is that a precautionary measure that they're taking?
Yes, absolutely. And I think the main reason for them to actually take that stance is to get people to, one, to be informed.
Yes.
And I mean, as you know, how I feel about it is when we educate people, we actually empower them. And when we share our knowledge, we actually empower them even more. So that's the big reason. And then the second thing, it's all about money. So if we declare something a health emergency, it means that there's going to be a budget for research. There's going to be a budget for the development of new vaccines. There's going to be a budget for the development of new therapeutics. So causing something a health emergency doesn't mean that we're all going to die.
Yeah.
And that's usually the reason why people actually call it a health emergency. And I think I just want to add something to what Howard said earlier about the genital lesions.
Yes.
And myself, being in the field of infectious diseases and also particularly sexually transmitted diseases, just to make it clear, monkeypox is not an STD. Monkeypox is not transmitted sexually. It's not transmitted via seminal fluids and any of these things. Okay. The reason for monkeypox to be transferred and transmitted is because of prolonged contact. So monkeypox is not an STI. And you know, when we talk about STI, it usually is accompanied by stigma, and stigma. And that is why people sometimes, when they think that they have monkeypox, they're going to be stigmatized.
Yeah.
Purely because it's considered to be an STI. So I just wanted to make it clear that monkeypox is not an STI.
Thank you for doing that.
In the last few months, since monkeypox have been around, you know, I have seen numerous cases of query monkeypox. People consulting me, they think they've got monkeypox.
Yes.
They think they've been in contact with people who have monkeypox. And I've also verified this with my colleagues at the infectious diseases department at Groote Schuur Hospital and also at Tygerberg Hospital. And we are yet to have a positive test for monkeypox, with a majority of the skin lesions either being due to what we call herpes viruses or varicella viruses, which is the brother of the herpes viruses, or other types of viruses like enterovirus. So up to this point in time, all the cases that have come forward of suspected monkeypox have not been monkeypox.
Well, I think this is quite important to let you know there is a part 3 of our discussion, and I want Dr. Howard Newman to jump in with testing a little bit later. So if you are looking to ask any questions, 063-408-8863. We're happy to take your questions on your Feel Good Breakfast Show as we get on to something in the kitchen.
It's my Feel Good Breakfast Show.
Welcome back. I'm glad you stayed there. It's Expresso, and we are wrapping up our discussion this morning on monkeypox with Dr. Emile Reid and Dr. Howard Newman. Now, all the reported cases in South Africa have been mild, with the first 4 patients having recovered while the 5th is in recovery. This is your last chance to ask our experts any questions regarding monkeypox and send through your WhatsApp voice notes to 063-408-8863. Now, we have a little voice note that's come through as well. Portia, you have a question to ask?
Good morning. This is Portia from Gabega. I would like to know, is there a vaccination against monkeypox already? Thank you.
Well, that's a very, very good place to go. And I think maybe let's open it up to our panel of experts. Before we get on to testing and the facets of that, a vaccination of some sort, where are we?
Yes, so there is a vaccine available. The older generation might recall the smallpox outbreak in the 60s and 50s, and you know, that used to be a deadly disease. But thanks to vaccination, we eradicated smallpox in 1977.
All right.
So the smallpox vaccine is equally as effective against monkeypox. So it's not like COVID, where we're starting from scratch, there is a vaccine available. We don't have it available in South Africa as yet, but if the need arose, I'm sure we could procure them. But the good news is we're not starting from scratch. They do exist.
So can we jump straight on to, because I know the question on vaccines, this is related to, how do you know you have it? And I know, Dr. Emile, you actually discussed about there are many reasons why those lesions can pop up. How do we know that we have monkeypox? So let's talk about testing for a second, Dr. Howard Newman.
Yeah.
What is that process like at the moment?
Okay, so testing is available. By now, thanks to COVID, I'm sure we all know what a PCR test is.
Yes.
So we have a PCR test available. It's a molecular test. It amplifies the genetic material of the virus, and the specimen type is essentially a swab of the skin lesion. So your doctor will actually take a swab, just like the one used for COVID, and actually swab those skin lesions and send that into the lab. Your doctor will also fill out a very detailed case investigation form, because that's important for the epidemiological side of things. When it first started, it was centralized at the NICD,
Yes.
but they've since decentralized and allowed other labs to test as well. So at PathCare, we do offer the test. It's very sensitive and specific, so if you do have monkeypox, that test will indeed come up positive. Yeah, there are other specimen types as well. Some doctors will collect a throat swab as well, but that's not mandatory. But the skin lesion swab is mandatory to diagnose monkeypox.
All right. Now let's talk therapeutics, Dr. Emile Reid. Let's talk about where we are, and let's look at what we've learned as well from the COVID-19 pandemic in terms of contraction to when the viral load is in your body. How long do you stay contagious? To the therapeutics, I want you to take us through top to bottom.
Well, I think I just wanted to add something that Dr. Newman said about testing. And the one thing we don't want is for people to rock up at their general practitioners or at the pathology labs and say, I demand a test for monkeypox, or my kid have been behaving like a monkey, so I would like him to get tested for monkeypox. And hopefully that name of monkeypox will soon be changed, because it came from the imported monkeys that was used in studies where it was first described. So even in this current pandemic, if we want to call it that, it's got nothing to do with monkeys at all. So we need to change the name. And because it's a DNA virus, we've been developing a lot of antiretrovirals and antiviral drugs in the last 50 to 100 years.
Yes.
And the chances are very likely that soon we will have an antiviral drug against so-called monkeypox as well. But the mainstay of treatment will be vaccination.
Yes.
So my advice would be, if you have a case where you're unsure, there are many specialists around, virologists, infectious diseases specialists in the southern suburbs, northern suburbs. Please phone people like us. Please phone the helpline, the NICD helpline, get advice in order for you to proceed further. So the whole thing with monkeypox, should you have skin lesions, all those lesions are self-limiting. And in the majority of cases, those skin lesions will all disappear after about 6 to 8 weeks max.
All right.
And it will not last longer than that at all. So again, even if you do have skin lesions, it does not mean that you are like a leper, that you have leprosy, and that people are scared of you because you cannot infect them just by standing next to them. There need to be prolonged skin-to-skin contact in order for you to be infected with the monkeypox virus.
thank you so much for clearing everything that we need to be cleared up. I think information is our most valuable tool against any pandemic and any sort of outbreak of this particular sort. So I think it's important for this information to be received by you, and with an open mind and with lots of openness to go and find more information from your side. But thank you, Dr. Howard Newman, for all of your all of your advice, as well as your practice. I think it's fantastic for you to bring that to our table. And Dr. Emil Reid, as always, our go-to guy when it came through to the COVID-19 pandemic. But it's great to hear you unpack this. And thank you for listening, of course. And if you do want to ask any more questions, just make sure you send that on to 063-408-8863. But that wraps up our chat on monkeypox. And now you know. But the things that you don't know is that there's a lot more for you on your Feel Good Breakfast Show.